In this video, I would like to show you a surprisingly simple way in which you can help yourself against pain in polyneuropathy. Normally, the pain with polyneuropathy is explained by the fact that damages accumulate in the nerves and then lead to erroneous signals that make you feel pain even if there is no real problem. So the nerves hurt because there is nerve damage, and there's very little you can do about that, because if the nerves are damaged by polyneuropathy, there's no real treatment for that. However, what is often overlooked is that pain often has more than one cause. That is, in addition to the pain caused by nerve damage, pain from other causes can add to the pain. Very often, the cause of such additional pain is in the muscles. Because, as you know, if you suffer from polyneuropathy, the disease causes you to have less control over your muscles and less strength. As a result, it is very common for a muscle to become overloaded and therefore form small cramps that no longer release on their own. This can cause very severe pain. Scientifically, this is called myofascial pain syndrome, but it is more commonly known as trigger points. The pain that these trigger points cause in the muscles is effectively indistinguishable from pain caused by nerve damage. So it is literally impossible to know whether the pain comes from the nerves or from the muscles. In my own patients, I usually see a combination of both. The good thing about this is that trigger points are very easy to treat. It can be done with a simple but special massage and some easy stretching. You can easily do this yourself. That's why I think you should just try this if you have pain caused by polyneuropathy. In this video, I will show you how to do this. The absolutely crucial thing to know about trigger points is that they often cause referred pain. This means you do not always feel the pain in the location where the trigger point is, but you might feel it in a completely different spot. For example, pain in your toes can be caused by trigger points in your calf. You can see in this illustration in red where the pain is. The black cross marks the location of the trigger point that is causing the pain. As you can see, the two spots are very far apart. And this is a huge advantage for polyneuropathy patients, because if you are one of those people whose feet can no longer really be touched because they hurt too much, then there is a chance that the treatment of the lower legs will bring relief. For all the trigger points, there are typical pain patterns that usually repeat themselves from person to person. This means that if you know where exactly your pain is, you can already tell quite precisely in which muscle the trigger point that is causing the pain might be. And I have listed the pain areas and the corresponding trigger points in my book, How to Treat Your Own Foot Pain, and it's combined with pictures to find them more easily. So to try and see whether this treatment method might help you, all you have to do is flip through the book and you can see where you should start to massage. But first, let me show you how to do this treatment and how surprisingly simple it is. I will now show you as an example how to treat trigger points in the calf, which often cause pain in your heel. And the same technique works for all trigger points that cause pain in your foot. First, you need to find the trigger point. To do this, press into the muscle at the point indicated in the illustration. A relaxed muscle will feel normal. However, if you press onto a trigger point, it will hurt. In order to find the right spot, you should therefore press into the muscle in the area indicated in the illustration and look for the place where it hurts the most. I have now actually found a trigger point, which is probably formed because I have been jogging too much lately. To massage the trigger point, I now move my fingers a little downwards from the painful spot. Then I press into the muscle and move upwards over the painful point. Once I moved my fingers so far up that I can no longer feel the pain, I release the pressure and return to the starting position without applying pressure with my fingers. And I then repeat the same movement about 20 times. And that's it. That's the whole trick. If you have found the right trigger point, then this massage is already enough to reduce the pain. However, if you have polyneuropathy, then such a massage should be done frequently, because the problem that the nerves are damaged is going to remain. That's why if you suffer from polyneuropathy, the pain usually comes back after some time. So I think you should know how to massage yourself, so that anytime you need to, you can do the massage again and you do not depend on others. The tricky part is simply to find the right spots to massage. As I said, I have made a list of all relevant trigger points for foot pain. In my book, How to Treat Your Own Foot Pain, you will find illustrations of the pain areas and the trigger points that match them. So you literally just have to flip through the book and look at the illustrations to find the areas that you should massage. I would personally recommend to order the book and try it. If you do not find it helpful, you can simply send it back. I hope this video was helpful for you, and thank you for watching.